background. In 2022, late 2022, I came to a point where I had to have a lot of teeth pulled. I inherited some kind of gum disease from my mother, and it just was getting bad. Meanwhile, less than 6 months later, I get diagnosed with colon cancer, and I know I have a lot of new subscribers, so at the end of this video, I'll link the playlist for that cancer journey. So, all right, partials, cancer. Just so you know real quick, I had 2 different cancers. They removed the cancer from the rectum, and then 6 months later, I had a recurrence of cancer in that same area. So they did another one. Now, in between those 2 things, I started having voice issues, really raspy voice. They sent me to a nose and throat doctor, and they saw that the thyroid was crowding out my vocal cords and causing a problem, and that it had probably been exacerbated by having so many intubations during surgery. So, okay. So now I got to get that out. In between scheduling for that thyroidectomy, they wanted it done before I went into my second cancer surgery. So, teeth back again. Big infection, pain in this tooth back here. Okay. I'm coming up on the tonsillectomy, and I know that they're not going to do this surgery with infection in my mouth like that. So I come to my dentist and I tell her, look, they're not going to do this surgery if I don't get this taken care of. So she arranged, because the lower partial is anchored to that tooth. So in other words, it pops on there, that tooth holds it in, along with some teeth over here, which ain't many of them left. So anyway, she arranged for me to have a root canal on that, and we were able to get it fast-tracked so that I could be rid of all of the infection and have everything in place before this thyroidectomy. So I go through that whole thing about having this root canal, and then they finally build the final cap on top of it. He did a beautiful job. This joker to look better than it was when I was born, you know. So anyway, fine. I get the tonsillectomy. I go into that second cancer surgery. Everything's cool. But within 3 months of having this root canal done, the cap just came off. I think that my partial kept catching it when I would remove it, so off it comes. It's still half. I still haven't gotten it pulled, because something's got to hold this partial in. So anyway, so that happened. Okay, cool. Moving forward. Now, I'm sitting up at my house the other day, and just bam, out of nowhere, a tooth started hurting so bad. And you know, I've had constant pain since 2022. There's not a day go by that I don't have some kind of pain. At one point, prior to my even having the teeth pulled the first time, it would be so bad, I would be in so much pain that no matter what I took, it didn't help. The only thing that helped was for me to get on the floor on my knees with my forehead down on the carpet and stay there for about 5 minutes, and then it would subside, but then it would come back. So it's been constant pain. That's nothing new here, the pain, okay? This pain, however, did not subside. So here we go again. Then she puts me on antibiotics, gives me pain pills. When she looked at that tooth, it looked like they call it angry. Boy, that tooth looks angry. The tooth angry. I'm about fed up. Just crap my darn self, okay? So anyway, she didn't talk about filling it. She didn't talk about root canal. She said we gotta pull it. Cool. So back to this. So when she pulled this tooth, I had her pull one down here because it had been bothering me since way before. But she wouldn't pull it in. She said it's just that the gums are receding, and that's what you keep feeling. But I told her to pull that sucker this time, and she said, yeah, lots of cavities. Look, let me go back. Let me go back to this root canal. So anyway, like I said, it popped off. And my next dental appointment, I'm telling y'all, that root canal had not been done 6 months. She looks at it and says, it's got cavities. Now, I'm saying, how can it have cavities when they drilled and drilled and drilled, took out all the nerves, but the thing got cavities? So I just said, okay, whatever, leave it there. It ain't hurting me, ain't no nerves in it. As long as it's not infected, I'm good to go. So that fast track back up here to like recently. So she pulled this tooth and she pulled this tooth. Now this tooth, when she pulled it, absolutely no blood. I mean, there was no blood. It came out easy. It's almost like that tooth was saying, I've been checked out. I'm just waiting for my luggage. You know, this one broke off, but she was able to get it out of there. Cool. So now what I'm dealing with is this doggone bridge here is anchored to nothing. I was taking my supplements the other day and almost swallowed the darn thing. At that appointment, she suggested that I have a full arch, have all the top teeth pulled, she said, and have implants done so that they can just put an entire, denture on the top so that you don't lose bone. Because once that root is pulled out of there, you losing bone. I have no molars over here whatsoever. Okay, and only a few teeth here. I don't think I have but 13 teeth left in my mouth, and they going bad. But this is the deal. She told me the reason why everything's going to heck in a handbasket here recently is that once you have chemo, your teeth go kaput. She says she had a friend who had perfect teeth. She never had a cavity all her life, got diagnosed with lymphoma, had the treatment, and all of a sudden, she got cavities. Where you look, there's cavities, which would explain why the root canal got cavities. Long story short, I have got to have something done here. I don't think I'm supposed to be living with pain on a constant basis. But it's easy for her to sit over there and talk about get the implants when it's going to be costing me. I've got insurance, but insurance, dental's insurance, if you got it, it doesn't cover anything. So now I'm just in this trajectory where I'm just going to keep losing teeth, keep staying in pain, I ain't got time for this, y'all. So this is what I've got to do. I'm doing everything I can to try to get financing for this thing. And I'm going to have to move forward with some kind of way to put it into this crap, because nobody told me that having chemotherapy was going to cause what little teeth I had left to go to heck in a handbasket. I could have dealt with the pain. The pain, it's intermittent. A lot of it is low grade. Okay, I need to correct that. Lately, the pain is not subsiding, even with painkillers. It's waking me up in the middle of the night. It's just been incessant, especially since I'm no longer wearing that lower partial. I have that partial in this video. It's to the point now where I've got to have something done. I'm going to go ahead and get, I want to get my treatment plans. And I want to get an actual, accurate estimate of what it's going to cost. And I'm going to take it to my credit union and see if I can get some kind of loan. I know I'm not going to be able to raise all of this video was recorded at the beginning of April. It's now the middle of May. And I have had that consultation. And I received a couple of alternate treatment plans. The money that it takes to have the upper teeth done, but I think that if I can afford to get a couple of implants here and have the anchor bridges down, then I can probably stretch this thing out for a while. Y'all, it's just one thing and another. And trust me, I am complaining, but I'm still grateful. I could be dead and wouldn't be having these problems, right? They caught the cancer early enough that, thank God, here I am 2 years out from ringing that bell. And by God's grace, there has been no recurrence of the disease. That's good. They caught it early enough that I have a good prognosis. I'm grateful for that. Not everybody that gets that diagnosis has this good outcome. Time will tell how good an outcome it is. But at this point, I'm very happy with my baby sister, as I've told many of you, died in her 40s. And she didn't have that good an outcome. She got diagnosed at stage 4. And she didn't live 5 years after that. And so I'm just blessed that, go to the playlist to see the turns of events that went on back then. Anyway, so I'm just to the point where I'm going to start a GoFundMe. Nobody's obligated to donate a single dime to this. And if I can raise enough money to have the upper teeth done, fine. But right now, I'm in the throes of some major student loan debt. And I'm trying to get that done, or trying to get that taken care of. And I'm on a retirement pay. You all know, if you've been here a while, that my whole business went kaput. I went 2 years without doing anything with my business. And I'm just beginning to try to get that up and going again. I need to raise this money. So I'm going to put a link below for those of you that want to contribute to get my teeth fixed. And it was apropos that I went to the dentist at the end of October of 2022 because it was Halloween season and I was fitting in Jackie Lantern over here. Anyway, that's my health update. MRI came out clean. I've got a CAT scan scheduled for next week. Future Linda here. Already had the CAT scan. It came out clean. No evidence of disease, thank God. And I mentioned in a previous video that now they got to go down my esophagus and figure out what that thickening is that they found in there. I'm not worried about that. I have been in and out of surgeries, in and out of oxygen tents ever since before I was even 6 years old. So I'm not worried about that. That's probably from so many intubations and everything. So I'll go get this crap done because that's what they want me to do. I'm not even worried about it. Me again, already had that procedure done. They did find some webbing at the upper part of the esophagus. They did check out the hernia, and that's not requiring any surgery. Thank heaven. So she did break through and break loose the webbing because she couldn't get scoped down there otherwise. And so far, so good. I go back to my throat doctor and we'll determine what to do from there. Overall, good news. But right now, I just need to get my teeth fixed. I need to be done with it. Just pull them all out, screw something in there, and let me live the rest of my life. So anyway, y'all, I just thought I'd give you that update and let you know that I'm going to start a GoFundMe. I'm going to also, just so you know what I am doing, I know that my insurance will cover just so much, but see, with respect to this bottom partial that's all loose and everything, my dental insurance refused to replace it because it has to be 5 years since the last time I got it done, and it's going to cost almost $4,000 just to get new partials. And my thing is, how many times am I going to do that? How many times? It's like having a used car that's nickel and diming you half to death, right? It has to come a point where I'll go ahead and fix this. Well, then I'll go ahead and fix this. And at some point, you get fed up and say, let me get another car. And that's exactly what this whole dental dynamic has been for me. It's like if I put $4,000 into some new partials, have to get some more teeth pulled, now the partials don't fit. Now I'm stuck $4,000 out of money and the things I can't even still wear. With $4,000 here, $2,000 there. I already had taken out a loan on my car the first time I went to the dentist to have all these teeth pulled and the partial done. And I'll do it again if I have to. I'll do it again if I have to. So I'm doing that. I'm getting my treatment plans, my estimates together. I'm submitting them to my credit union. I'm going to see how much everybody or whomever will cover of this. And then I'll just start to GoFundMe. I've tried not to do this. I've been a whole year dealing with this and thinking about a GoFundMe and decide not to do it. So the link is below if you want to help out. Nobody's obligated to do so. I'm sure that I will figure something out, but depending upon how much I might be able to raise through the GoFundMe will determine whether I can go ahead and get it all done or just piecemeal some stuff so that a partial will stay in my mouth. Anyway, thank you guys for listening, and I'll be out with another video very soon. Thank you for all your support over the years. I love and appreciate all of you more than you'll ever know.